The Office of Civil Rights announced Phase 2 of the HIPAA audit program. Now here's the page of the announcement. Now a new round of audits will occur. However, it's unlikely you'll be selected. What's more likely is that you may have an OCR investigation due to a patient filing a complaint. This is due to the fact that only a few hundred organizations will be audited, and the overall pool of potential organizations is 1 to 3 million. However, there are thousands of investigations a year. Here's a chart showing the yearly complaints being filed by patients. And you can see that the numbers are going up every year, and there are many thousands of them. The OCR has historically investigated about 18% of the cases. That's pretty high. One of the first items they ask for is a risk assessment document, and the risk assessment is a snapshot of an organization's HIPAA compliance and documents areas that require mitigation and includes a disaster recovery plan. Another area of audit risk is meaningful use. If you receive funds for meaningful use compliance, your overall yearly chance per year for an audit is approximately 20% for just the meaningful use portion. The focus is on the risk assessment. If you do not pass the audit, you may be fined or asked to return the funds you received. There have been cases where fraud was established and jail sentences were imposed. Now, the new audit protocol includes business associates. Business associates will now be audited directly by the Office of Civil Rights. In addition, any covered entity, in other words, a doctor or health clinic, being audited will need to provide a list of BAs and general information about their HIPAA compliance, and that includes 2 contact names. The fine for not properly evaluating and monitoring a BA can be $50,000 per business associate if in willful neglect. Make sure you track your business associates and do yearly reviews of their HIPAA compliance and keep your contact list up to date. HHS has published information on the new audit protocol, and it contains a lot of good information to follow to be HIPAA compliant. Here's a link.